And we said all the time that we want our students back. We recognize that nothing can take the place of that face-to-face teacher with the students in the classroom. In the inspiration this morning, you certainly saw good teachers doing some amazing things. But we don't think that they are as amazing as they would be if they're face-to-face. So I'm going to call on Ms. Avant briefly to share with you the district's plan as we move forward to get our students back.
Good evening, Madam Chair, Madam Vice Chair, members of the board, Superintendent Dr. Perry and Colonel Logan. I'm going to share some of the highlights of the reentry plan with you. I won't read all of this to you, but definitely let you know what conversations are being had and what things we're really focusing on. First and foremost, as Dr. Perry said, we are absolutely committed to making sure that our students return very safely. We want to make sure that we get them all back in because we do want to provide that face-to-face instruction. So we will have a reentry schedule. All staff will be back in their buildings by September the 14th. And then we will start September the 21st, bringing in those identified special education students and students in certain grade levels. And here you can see that we have a chart as far as what students will be coming back in phase 1 and then what students will be coming back in phase 2. Attendance, students are required to attend school in accordance with the Georgia compulsory attendance regulations. And those students who remain in the virtual model due to parent request will continue to have attendance taken through Canvas. We also are making sure that we are addressing safety in our classrooms as far as making sure that we're continuing to do the cleaning and the sanitizing regularly, making sure that we are social distancing to the extent possible. Which includes classroom configuration. It may include some of the teachers moving more so than the students, making sure that we're not sharing personal items as and classroom materials to the extent that that is possible, and then making sure that we reinforce that good hygiene. We do have plans for, we already have hand sanitizer and other cleaning materials in the building. And then we will not allow the parents to escort the students to the classroom, and visitors, that part will be minimized, as you'll see in a few minutes. As far as cleaning and disinfecting in the schools, all of our buildings have received a deep cleaning and they've been sanitized and disinfected. We conduct those building inspections regularly. We will have masks available and face shields and hand sanitizer to include the refills as they are available. We have thermometers that have already been provided to our schools. Anyone entering the building should be scanned. And then we have the school safety protocols will be followed if temperatures are higher than normal. And we have a screening tool for that. Air conditioning units and equipment have received service according to the established protocols and timelines. We have all of the signage that's recommended from the Department of Public Health and the CDC. We have disabled our traditional water fountains. And they will continue to remain inoperable. The bottled water fountains will be installed in schools no later than September the 11th. We've increased the amount of wall-mounted hand sanitizer dispensers, and then making sure that our frequently touched surfaces throughout the day are cleaned according to those guidelines. Here you will see our self-screening tool, and I won't go through all of that with you. But it is a screening tool to make sure that we are keeping our students safe by screening those individuals that they will come in contact with, and to keep our students and our staff safe. Face coverings must be worn by students and staff. Any individual concerns regarding those face coverings will be addressed with the school principal. And those wearing of those face coverings should follow the guidelines set forth by the Department of Public Health. And we want to make sure that our face coverings, that the logos, designs, etc., should not be offensive in any nature. And then we also have those procedures in place if there is a positive result for staff or students. And we will follow those recommendations from the Department of Public Health in that situation, shall it arise. As students and staff arrive, They will have health screenings for all students and all staff members. They will have their temperature screened, but using a touch-free infrared thermometer. They will practice social distancing while they're waiting to be scanned. And then that also helps to ensure the individual's privacy. And of course, if there is a temperature greater than 100, there are guidelines and procedures in place to ensure the safety of our staff and students for anyone who does enter with a fever. We do have plans for a holding room, and we have guidelines for those to ensure that the students and staff remain healthy and to minimize exposure. So if the student comes in at 100 degrees or greater, they will report to the holding room until such time that they can be picked up by a parent. And then there are guidelines for those who will be operating those holding rooms. As far as academics, students in the grade levels identified to return on the above dates will be provided in-person, face-to-face instruction by the teachers based on their schedules. Those who will continue virtually for that short period of time will be provided instruction by teachers according to their schedules, but will continue to be provided that virtual instruction using Google Meets and Canvas. We will encourage staff and parents to conduct parent-teacher conferences, IEP meetings, 504 meetings, faculty meetings, PLCs, anything that they can do virtually to continue to do so. And all classrooms will be required to have an active Canvas component. And then teachers who teach special education or multiple grade levels may be required to provide face-to-face and virtual based on those accommodations and based on scheduling. And then we do have a plan for our students with disabilities. Certain groups of those students will return on September 21st, and then the others will return during phase 2. We do have transportation services planned for those, as far as making sure that we have transportation for those students who need that, and then also for the meal delivery. So we do have a plan to make sure that all of our students have access to those healthy meals. We will be embedding an additional piece as far as human resources go, and that piece will be added tomorrow morning. And then for athletics, fall sports will resume on September the 9th, and the school district will follow the Georgia High School Association guidelines for sporting events and practices. We do know that we will have some parents who will choose to have their student remain virtual, so there will be a virtual option. Though we do know that face-to-face is the best method for teaching our students. If parents are uncomfortable with face-to-face instruction due to COVID-19, there will be an option for virtual learning. But families who wish to have one or more of their students continue with virtual learning will need to complete the form located on the school system website by Thursday, September the 17th. We do need one form for every student. Any questions?
Board members, you have questions? I can't see everyone. Board members, you have questions? Okay, Susan, did you address the changing of classes?
I apologize. We are encouraging if it's possible for the teacher to transition, then we would like to do so. As it can be done, but we do recognize that it's not an option in all grade levels and in all schools, in all situations. So as it can be done, we would like to see that that's done as much as possible.
So are you saying that there has not been any plans on how the students will change classes? I just remember saw up in North Georgia. I'm asking because we're talking about masks and social distancing. So I'm asking, is there a plan in place if you're on, let's say, the 600 hallway and the bell rings and kids are going in different directions? Is there a plan in place for those children, how they're going to exchange classes? Dr. Perry?
Yes, Madam Chair, thank you for that. Yes, the principals, each principal, one of the reasons why we're doing the phase in is because this is certainly something new to everybody. And so what we asked the principals to do, even when we thought we were coming back before, was to begin putting a plan in as to how they could social distance as much as they could with as many students as they had. So now we're bringing back, in the first wave, for instance, in the high school, we're bringing back 2 grades. And the principals, and that's why we're getting our teachers back, because staff and administration is going to have to work on how they're going to do that. And so we are asking them, we changed the date for the teachers from the 10th, which would be Thursday, we're extending that to Monday. Now they'll have a whole week to work with they'll know, Mr. Ryan is going to give them the number of students that they'll have in the 12th grade. They'll know how many teachers they're going to have. And then the staff and the principals are going to come up with a plan that they can best social distance those students, how they can change classes, how they will go to lunch, and all of that. And one advantage to bringing back the smaller numbers is that they will have a chance to get the 12th grade and the 9th grade straight before the 10th and 11th grade come back. And same thing in elementary schools as well.
Okay. Do we have a plan in place as to if a child in, let's say, a biology class is identified as being infected or have been in contact, how are we going to notify, or are there guidelines from the health department about contact? How is that supposed to roll out?
Yeah, we have some, and I'll say to you that our health department here worked extremely well with us, because we have had some cases, even though we have not had, we've had some teacher or some staff problems. But what we do, and all of these cases are totally different, and they are handled different. There are some privacy things that you have to cover. So what we do, and it's actually in our plan, once the principal notified the superintendent's office, we will immediately notify the Department of Health, and they will talk to us. They will do all of the tracing. For instance, they will ask us, okay, well, this is a teacher. How many kids have been around this teacher? And they will take up and actually do the contact tracing and tell us, of course, who is supposed to be quarantined and the like. So to answer your question, we go directly to the health department. We tell them what we have, and they kind of talk us through and handle all of the tracing, for us.
Okay, Mr. Johns, I think I saw your hand.
I think Dr. Martin had a hand up before me. I'll yield.
Okay, Dr. Martin.
Let me get my thoughts together. Okay, there is a national conversation going on about Labor Day, and around the country, we are waiting to hear what the implications of a lot of the gatherings that happened this past weekend, how those are going to impact numbers in various states. So I know that the current plan projects that students, the first phase is going to begin September 21st. But is there a contingency plan in place in the event that the numbers start going in the opposite direction? Are we prepared to delay our phased in approach if that does occur?
Absolutely, Dr. Martin, and thank you for bringing that up. I mean, all of this, we are in good shape right now. But certainly if things changed, then we would have to make those adjustments. But one of the things that we said to our parents and to our students, that the reason that we were making this call was based on the science of the coronavirus. And and of course, with parents and students and everybody in Liberty County kind of doing what they're supposed to do, we're fortunate to be in a great position. We are going to say to our students, our principals, we had a meeting this evening. They're going to be meeting with parents, because it's going to be crucial that we all continue to practice the things that have gotten us able to go back to school. And so, but it needs to be understood that, you know, if things change, because that 2 weeks, I think we're looking at about 2 weeks for the first wave to come back. But certainly if things change between now and then we would have to, I mean, we'd have to change and go in another direction. But right now, we just feel like this is the best thing that we need to do. Is to begin moving our students back, because that's what we kind of said we would do when we actually decided to go virtual.